This is Teresa from Life Beyond Diabetes. Today we're going to talk about how to take your blood glucose, also called blood sugar. It's a pretty simple process, but what I've found out is that a lot of times patients are told to take their blood sugar. They go to the pharmacy and pick up their meter, and nobody's told them the proper way to take their blood sugar. So we're going to do that today. The first step is to wash your hands. Now, I washed my hands just prior to filming this video, so that's not really necessary for me to demonstrate. The reason we're washing our hands is that if you don't wash your hands, what can happen is that you might have picked up some extra sugar or just gunk on your hands throughout the day, and that can give you a false high. If we want to know exactly what your blood sugar is, you got to wash your hands first. The next thing you want to do is to gather your supplies. So I've got a little kit. They usually come in little kits, and it comes with a glucose meter, a lancing device, which is used to poke your finger, and test strips. So first I'm going to talk about the lancing device. Oh, I also keep a little tissue here so that when I've got that little drop of blood, I can just wipe it on there and not worry about getting blood on anything. So the lancing device is pretty straightforward once you understand how it works. First is a little dial. Mine goes from 1 all the way up to 7, and that dials in the depth of the finger poke. So if you've got pretty fine skin, or if you're using a brand new needle, for me, I started at 2. For people with thicker skin or maybe calluses on their finger, they might need to start at a higher number. So I mentioned brand new needle. The needles are prescribed, most physicians prescribe them to be used, to be changed every time you poke your finger. That's really excessive and can get expensive. I usually recommend that you change once every couple days, every day or two. The sharper the needle, which is the newer the needle, the less the poke will hurt. So the way to change it is you take off the cap, and then you carefully pull the needle out and set it aside somewhere that you're not going to poke your finger later. And you take the new one, slide it in, twist off the cap. It came out. Try that again. Twist off the cap, set that down, and then you very carefully put the cap to the lancing device back on. You want to do this without bumping the needle, because that can make the needle, it can bend it a little bit, make it more painful when you're taking your blood sugar. And then before I forget about it, so I don't accidentally poke myself later, I take this used one and I poke the end into the cap of the new one, set it aside, and I'm going to put it in my sharps container a little bit later. So because I just changed the needle, it's already primed and ready to go, but it's spring loaded. So what I would normally do is I would pull the spring back, and then when I put it up against my finger, I'll push the button and it makes a little click and it springs into my finger. So when it's time to take my blood sugar, I take out a test strip and I insert it into the meter. Some meters require coding, that when you do a strip, you have to code to match the strip to the meter. If your meter is like that, it will have come with instructions. I'm not going to talk really much about that because most of the newer meters are automatically coded. So when it's time to take my blood sugar, I've already washed my hands. I'm going to prime the lancing device. I'm going to poke a spot on the side of my finger. A lot of people go for the fingertips, but the side of the fingertip has less nerve endings, and so doesn't hurt as much. So we're going to poke right here. And there's a teeny drop. I'm going to squeeze just a little bit so I've got some more blood coming out. I'm going to set it next to it, and the strip just sucks it up. And then I'll wait for the result. So I've got my result. My meter lets me choose if it's before or after a meal. Most meters have that function. So it's before a meal for me. And we're done. So in my little kit, I've got a little pocket. I keep the strips to throw out later in the day. And we're all set. Now, I'm not going to talk today about what the numbers on your glucose meter mean, but I do have a handy little guide that talks about the different blood sugar levels and things that you might want to talk about with your provider. So there should be a link below this video. Go ahead and click on that link if you're interested in picking up that free guide about understanding your blood glucose readings.